What is humpback posture, its causes, and how to get rid of it?
Today we have had a case. Sees a lady, 25 years old lady. She complains about the lower cervical spine pain, and which is a conjoined part of the lower cervical and upper thoracic. The condition is otherwise known as humpback and Dagor sign in medically. So this is a prime condition nowadays. Most commonly it happens to younger generations. What are the causes? Causes are varieties of causes are there. Some causes such as prolonged duration of computer uses, prolonged duration of mobile uses, WhatsApp, Snapchat, or any kind of other social media platforms most of the younger generations are used to. Then in that cases also only they usually bend their neck, and in order to use the keyboard they usually bend their neck as well as shoulders in order to perform the activities. So most commonly because of that only it happens, and consequently if we'll say these things in a long term, the cervical spine get into the flexion, and because of that we'll get a humpback posture. Okay, so the complications are quite plenty. The certain complications are like stiffness of the neck, and range of motion of the neck will be quite restricted, and there is a migraine, and patient may exhibit a drowsiness in the morning time or evening time. Patient may express you deep headedness, and these kind of conditions are also associated with sometimes fever, false fever we can say. Okay, so lots of other comments are also there that can we can see in social media platforms what are the reasons the thing is happening, but certain measures that we take in order to curb that situation and treat this as certain basic exercises. Most probably the thoracic spine and upper lower cervical spine muscles extensors are getting tighter. Because of that the neck doesn't allow the movement to happen properly, so we can easily stretch the extensor muscle of the spine, upper lower cervical spine and upper thoracic spine, by asking the patient to lift the shoulder like this. Lift the shoulder. This is called as Y shape. So the patient can hold the area like this and hold it for 30 seconds, then release it, then bend the elbow and maintain like a W like shape and hold it for 30 seconds, and gradually she can extend it to backward like this and hold it for 30 seconds, then release it. Okay, and this kind of exercise can be done, and along with that the patient can also do back cervical extensor exercises, like put both the hands below the head and ask the patient to bend the neck backward while putting the resistance towards forward. Okay, ऐसे कीजिए, ऐसे पीछे बेंड पीछे ढकेलिए. ओके, उसको हाथ को ऐसे आगे थोड़ा प्रेस कीजिए, उसके बाद नेक को पीछे ढकेलिए, उसको ऐसे होल्ड करना है 30 सेकंड. So like this you have to perform it for 30 counts, then hold it for 30 counts, then release it, then do it 2 to 3 times per day, at least 10 to 15 repetitions. So you can easily get the relief because the muscles are getting stiffer in the extensor area. You have to stretch that muscle. Okay, and flexor muscles are also quite in hypertense mode, so you can release the flexor muscles and strengthening the extensor muscles so that you can get the relief. Thank you.